Hello, my name is Celia, and today I'll be presenting the ethical concept of absolutism in the HLSE 220 oral presentation. I will be defining this ethical concept. I will be discussing the ethical concept in healthcare with reference to its ethical principles and theories, and how this ethical concept is critical in nursing. I'll also be describing the relationship between this concept and nursing codes of ethics, whilst also identifying ethical disagreements with this concept. So, in society, absolutism is the belief that certain moral principles can be universally applied to all people, regardless of circumstance or context. Immanuel Kant, who is a moral absolutist, believed in moral duties that applied at all times to all people. Kant believed that all things are either right or wrong based on what is rationally consistent and what one wills to be a universal law. In healthcare, there are certain rules that healthcare practitioners must abide by. These are called the Codes of Conduct for Standards of Practice. These are set by the MBA that all nurses must abide to practice nursing in Australia. For example, a standard of practice all nurses must abide by is Standard 6.2 of the MBA, which is where nurses must practice within their scope. This relates to the absolutism, as it supports the notion that a moral principle must be applied to all people regardless of circumstance. The Code of Ethics touches on the bioethical principles that nurses must abide by, which are autonomy, non-maleficence, and beneficence. Autonomy is to be self-governing, and Kant believed that people should be treated as ends in themselves, as not mere ends to others. In healthcare, nurses are meant to give their patients the right to make decisions about their own health, which is being self-governing, despite their own medical opinions. Nurses must also treat their patients with dignity despite their medical conditions. This ensures that patients are being treated as ends in themselves, as not mere means to ends of others. Non-maleficence is the idea that above all, do no harm. As nurses, we must do everything in our power to ensure that our patients are free from harm. We ensure this through medication checks, ensuring we are giving the patients the right medication, patient advocacy, and using safe and clean equipment. All these aspects are rules that all nurses must use to reduce the risk of harm to patients. Beneficence entails that above all, do good, which is the obligation to act in the best interest of others. This includes virtuous actions such as care, compassion, and sympathy. As nurses, it's not just about preventing harm, but it's also about ensuring we are acting for the benefit of our patient, which can be done through education, advocacy, or providing support and promoting health and well-being. Absolutism is the notion that some moral principles are universally applicable regardless of context. In nursing, we are given a code of conduct that is universally applies in every hospital that all nurses must abide by. This allows nurses to have a firm foundation in the care that provides clear do's and don'ts in patient care, ensuring there is less room for human error and more consistent care that benefits all patients. It allows for all nurses to be set to the same standard of care and reduces bias in patient care. Through this, it ensures human rights are upheld universally, not dependent on culture, convenience, or individual opinion. The Code of Ethics promotes the laws, regulations, and professional standards of countries that govern nursing practice. It highlights that nurses must respect human dignity, patient confidentiality, and person-centered care. These rules universally apply to all nurses regardless of circumstance. The Nursing Code of Ethics reflects absolutist principles as it establishes universal ethical standards that are meant to be upheld no matter the circumstance. With these codes, nurses can navigate ethical dilemmas that may arise, and they can rely on the absolutist approach to guide their next steps. An absolutist approach has set rules that allow consistency in ethical decision-making, maintaining safe and patient care. Overall, absolutism and code of ethics both allow for consistency in nursing care, which allows for integrity to be maintained. By having set rules that everyone must adhere to, it creates a firm foundation in how nurses should navigate care for all and approach all types of patient care. Absolutism believes that lying is always inherently wrong, and this is a standard that must be adhered to. But at times, nurses have to withhold certain information from patients that could cause distress, which goes against the absolutism aspect of non-maleficence, which is above all do no harm. Autonomy means to self-govern, giving patients the right to make decisions about their own health. A nurse may see this as a guide, an informed choice of their own health, as they believe that they understand the patient's medical conditions better than the patient does, and therefore would provide better strategies for patient care than they could for themselves. Absolutism applies fixed and universal laws, regardless of the situation, whereas relativism believes that there are no absolute truths in ethics, and what is morally right or wrong varies from person to person or from society to society. This allows for patients of different cultures, ages, socioeconomic status, and gender to be taken into account, promoting flexible, culturally safe, and patient-centered practice, which absolutism does not take into account. In conclusion, absolutism focuses on the universally applied principles that can be identified in healthcare. All nurses must abide by the many codes of conduct that nurses have to follow to give the best patient care, which shows an absolute approach, though there are different disagreements on how the absolutist approach is applied in healthcare and ethics. Thank you.